government is spending $250 million a year to enhance the quality and affordability of care for the elderly. By the third quarter of this year, subsidies will be raised by about 30% annually, while two-thirds of Singapore households will qualify for the home and community-based services. And that's because the qualifying per capita income will be raised from the current $1,400 to $2,200. Vimita Mohandas with more.
The government is tweaking the subsidy framework to make intermediate and long-term care services more affordable and accessible. Subsidies will be raised to as much as 80%. And for a start, subsidies at community hospitals ranging from 20 to 75% will be extended to all patients. The middle income will get the largest increase of up to 50%. Now, to make residential long-term care services such as at nursing homes more affordable for the middle-income group, the qualifying per capita income for subsidies for these services will be raised from the current $1,400 to $2,200. So for Kwong Wai Shu Hospital, about 70% of its 300 patients are currently subsidized, and the hospital is happy to note that with the new subsidies, more of its patients will stand to benefit.
We can provide better quality care for the patient. And number two, with the extra dollar, we can also help those really poor, perhaps can give them more on top of the government's subsidies. And then the third is we can take care of more people.
A new foreign domestic worker grant of $120 will also benefit households with an elderly family member who can't perform 3 or more activities of daily living, or ADLs, such as feeding, toileting and mobility. But the government says this is not cast in stone.
We feel that this is one of the criteria. Minister of Manpower feels that is one criteria that is necessary in order to secure the grant. However, I think we ought also to, from time to time, review to see whether we need to really have 3 ADLs or whether can be lesser number of ADLs. So we need to monitor this closely.
The Community Development Ministry will also adopt the same enhanced subsidy framework for services such as elder care and adult disability care. Under the new IDEP scheme, disabled elderly will get higher payouts of up to $250 a month. The qualifying per capita household income will also be raised from the current $1,000 to $2,200.